Hi guys, welcome back to my channel. My name is Daisy. If you are a new subscriber, thank you very much for coming back. And if you're a returning subscriber, thank you very much for clicking on my channel again. So guys, today I have one of my very close friends and we're just gonna have a little girls talk, chit chat, talk about school, nursing school, talk about work, talk about everything. Before we get into this chit chat, I'm just gonna let her introduce herself to you guys because you guys are gonna be seeing her a lot on this channel. So yes.
Thank you so much for having me, Daisy. My name is Juliette.
Yes. So guys, if you don't know, well, I've already talked about this before. So I'm a nurse and Juliette also is a nurse. But then the difference between both of us is she became a nurse like 2 years before me. So she has a lot more like work experience and all of that good stuff. So we're going to just be talking about nursing pretty much in school and the good stuff. So yeah. So I think we're just gonna be asking each other questions and then just talking and we'll just go with the flow.
Okay, sure, that works.
So what was it like going to nursing school for you? Because honestly for me, I hated it. I'm not going to lie. I really hated it. I hated the classes. Well, some of the classes were good. I hated some of the classes. Honestly, there were nights where I would just bawl my eyes out because of homework.
Yeah.
Submitting like everything from like clinical. It was hell. And if I had the chance to do it again, I would not do it again. Honestly, I honestly would not.
For me, nursing school is definitely tough. It's like one of the hardest things that people that have gone will say, oh, it's one of the hardest periods of my life. And the program I went to was, I would call it like an accelerated program, so it was within 10 months.
Yeah.
And usually it's kind of like a curriculum that people do over 2 years. So imagine it being packed into 10 months. There were no breaks. So I think aside from like the volume of material that we were going to study, the fact that it was just not ending. It was like there were no breaks. So like from one thing to another, we had exams I think
Every other week.
Yes. For us it was every week.
That's crazy.
So like we had exams and then we had clinicals, and like you said, we had paperwork for clinicals. It felt like it wasn't ending. But it was definitely stressful. And I'm doing it right now again.
Yeah,
so
you're doing it again.
It's
so.
like, oh yeah, I don't know, it's just a lot.
Okay, so with working, I know both of us, we have like healthcare experience where we've worked in like different healthcare settings and then nursing and all of that.
Yeah.
What has been like your experience like working?
As a nurse or as like
a nurse in the healthcare field?
Okay. Yeah. It's been, for the most part, it's been good. For the most part. I feel like the job in itself is not predictable, but like when you know what you want to do, you do it. But it's dealing with the people.
Sure.
It's the people that kind of like make it difficult sometimes. And most of the time it's like you're maybe the only young nurse among like people that have been working there for 15 to 20 years, and like they look at you at first like, okay, you're the nurse, and you're like, yeah, I'm the nurse. And then you have to kind of like prove yourself to your fellow nurses, your patients, family members. So it's just a lot navigating through.
And the worst part is that some of them, like you go ask an honest question, you just say, okay, and you're like, you're supposed to know this.
Exactly.
You just got out of school. I'm just like, if I did, I won't be asking you.
Exactly.
What?
And you know, there's this thing they say that nurses eat their young.
Yes.
It's true, which is not supposed to be, but like, I don't know why there's this, would I say fear with the older nurses? Like they don't want to show the younger nurses the way, you know, they just kind of like leave them out to dry or something like that. I don't know, but it's something that we really need to work on as nurses.
And I feel like it's something that happens across the board. Maybe there's like 1 or 2 nurses who might be willing to help.
Yeah.
And you even see that from like clinicals. Like when you go to clinicals and like you're in your last like semester when you're like doing everything that the nurse is doing,
Yeah.
and the time when you're scared and you feel like, oh, I need the nurse's assistant, is like you should know this. You went to school for this. Like, we're not gonna help you, and you're like, okay, but this license is important. If you mess up, you're putting yourself at risk. But it's just really painful.
Yeah, and I like what you said about, like, even in clinical you see, because you see the nurses that are willing to help in clinicals, and you also see the ones that pretty much don't really care about you as a nursing student. You know, some will really teach you, like, oh, this is what you're supposed to do, this is how you, like, pass the meds and this and that. But, like, some will just look at you like, yeah, well, you should know this, like, you know. So it's just, I feel like for me, it made me realize the kind of nurse I want to be when I'm on the other side. So,
and I remember that during clinical, every time, there was one time, so after like the second session was, we already started doing meds and we're starting to do like wound care. And our instructor was like, well, there's a bunch of nurses at this facility, excuse me, and she was like, well, I'm not going to put you with the nurses on this floor because they don't like teaching students, and they feel like students are just me. Like, they don't want to, like, they're not students at me, but they feel like students are not picking up at their pace because they just want to work fast. And then it was so funny when we saw the nurse, they were actually young ladies. And I'm just like, the older ones are the ones who wanted to teach and be so helpful. And then the young was like, no, we don't want to teach anybody. And I'm just
you would think that it would be the opposite, because the younger ones pretty much just finished from school, so like they went through what you're currently going through. But yeah, sometimes it's not that way, and it's just unfortunate.
So well, I know you're in school, so obviously you like nursing that much. That much. But then what would you say about like how you're being treated because of like your skin color, being a nurse? Would you say it's hard, or it's been hard from like nursing school to working? Would you say there's any difference?
In nursing school, it's different because you pretty much can't sit most of the time. Like, you're there and you just want to like get through the program. You don't want to have, you know how competitive it was to get in, and you know how people are like fighting to stay in the program. So you pretty much don't want to be sent out because you maybe talk back at someone, or so you're kind of like keeping your cool. So that's the way I see nursing school. Even though some people are able to like, you know, stand up for themselves and like say stuff, most of the time I just like keep quiet and let it slide on my good days. But like, it's different when you're a nurse, because not like you don't face discrimination of any sort, especially sometimes from co-workers, sometimes from patients, sometimes from their family members. But this time you're in a position where you can actually, you know, speak for yourself and like say, you know what, you're my priority, I want to take care of you, but it's unacceptable for you to like speak to me in that manner. And you can kind of like direct the situation in another way, or you can maybe report to your manager if they're helpful. Most of the time it's not the case.
And that's it's really, really like sad, because you feel like you're supposed to have the managers where you can bring your complaint to, and they should do something about it. But then the thing you get is the patients are always right, the customer is always right, and then it's like, I understand the customer is right, but I'm just trying to do my job, I'm just trying to help this person, so why do I have to be treated like this? And it's just really like, sometimes you just really want to just like cry your eyes out, like, why am I being treated this way? And all of that just makes you think about America in a whole, and how people are just treated. I know everybody just talks about how like, oh, black people this, black people are always complaining, but I'm like, it's unfair, because you get that at your job, you get that in the grocery store, like everywhere. It's so painful. Everywhere. It's very painful. I remember in school there was this Spanish girl who would not take rubbish from anybody. She would always stand up for herself, and they wanted to kick her out because they felt like she was being disrespectful. And then you turn around, and then there's a couple of white girls who, when the teacher's teaching, they're on Facebook and you're talking and disrupting class, and they will say nothing to them. And I'm just like, it's unfair.
Yeah.
Like it's not right. You can't treat people like that.
Yeah.
And even asking questions in class, like
If you
a black
ask
person
too
would ask,
much,
it's like
if you ask
you're
too
disrupting
much,
class.
right? So we started when this whole pandemic started. We switched to online, and a lot of people were like nervous and anxious, and like, oh, how are we gonna do it? Nursing school is already hard in itself, and now we're going to online. So first off, like there are not many black people in my cohort, mostly Caucasian people, which a lot of the programs that's the way it is. But so like you find out that the minority in the class, they kind of like sometimes they form a group just to like support each other and like just keep an eye out for each other. So like this girl we were on the Zoom class, and she was kind of like asking questions because she's older, she's not really tech savvy and stuff. So like she was asking questions, and then the instructor was like, oh, we have a lawyer in the class. So I texted her, like, I'm like, you better stop asking questions. You know what I mean? Because that way they kind of mock you. Like, they put an eye on you, like, oh, that one, that one. And
it's just sad.
When you are in an environment and you feel excluded from the majority, even that in itself is a stress. Like, I was working in a place, and I was not only the only African American nurse, I was the only black person in a leadership role.
Okay.
So like every other person they were white, or white, Italians white, Brazilians white, right?
Yeah.
And then the other positions, like the other black people I saw, they were maybe the CNAs or like the janitors, or like not in a leadership role. So you come into work, and the family members see that you're not, because if you're in a leadership role, you don't have to wear scrubs. So you wear like regular clothes, street clothes. So they see you in street clothes, and they look at you like, okay, like, who are you? And then they see your badge, but then they overlook that, and they start talking to you like you are other than your position, So these are the things that we have to work through every single day, and we still have to keep our smiley face, attend to them like we're not going through pain on the inside. It is really frustrating, but I think that we end up developing thick skin towards it, and sometimes we speak up for ourselves, sometimes we kind of like just let it slide.
But then at the end of the day, you're not at a job to feel stressed out and to feel that way. Like, you shouldn't be waking up in the morning and saying, oh my God,
I have to go to work.
It's
I
like,
know.
Jesus, I have to deal with these people again.
I
like,
know.
Really?
I know.
It's just so painful. And I feel like no matter where you go, it's one thing or the other. Like, you cannot
escape it.
You
can't escape it. I feel like it's better if there's like another person or like other set of people in that role that you are, if you're not the only black nurse, or if you're not the only, you know what I mean? That way you can like talk to people, or like when you bring up something that you're going through at work about, like, oh, this person talked to me this certain way, it's not just you against all of them. Someone else is able to like chime in and be like, oh, I also went through this, because they might say they understand. Do they really understand? Because you have to go through it to understand what it is. It's just, nursing is hard, but then having to like deal with being a minority, it's just even harder.
Sometimes I'm just like, I wish I never even set my foot
in
into
nursing.
this.
Really?
I wish I never set my foot into it. I'm not lying. Like, I really wish I never did. Because,
really?
Yeah. Because like, I feel like the honest truth is I've always wanted to be a psychologist. Like, that's something I've always wanted to do since I was little.
Yeah.
Like, a lot of people who know me, they know that I've always wanted to do. But to be honest, I moved to America, and it's like, okay, nursing,
Yeah.
It helps with everything. To make a lot of money as a psychologist, you should have at least your master's
or even a doctorate.
Yeah,
yes.
and I'm just like, I really don't have time for that because honestly, I didn't come here when I was like 12.
Little.
I came here like I was already going right into college. So it's like I don't have the time to play around. And it's like, yeah, I went to an undergrad where I got my psychology degree, and it's like, then what? It's like my parents are looking at me like, okay, you've graduated. Like, okay, are you going to be working in a job where you're going to be getting paid $16 or $18 an hour, and
what
you're
is
not
that gonna
like
do?
you're not even making enough money to take care of yourself or anything? And I'm just like, you know what? I'm just gonna go do it. And going to school alone, like even though I know like I have a background with like science classes and whatnot, it was tough, and I pulled through all of that. And then you go to work and you have to deal with all of this extra stuff. It's just like, did I really need to do all of this?
But you know, the good thing with nursing is that there's a variety of things that you can go into. There are like so many things. If you don't want to work bedside, you could work at a doctor's office. If you don't want to work at a doctor's office, you could work, like, there's so many options.
That's true.
So if you feel like, because you don't want to get burnt out.
That's
you know,
That's
you don't want to get burnt out. Our profession, we deal with people a lot, and they look at us for that. I don't know how to put it, but like, they're looking at us, and we don't want to put whatever it is we're going through on them, you know. And plus, our job is stressful. I don't want you to get burnt out because it's really crazy. I know I have my crazy days where I come home and I'm like, oh my god, today was the worst day.
You should hear me ranting. Oh my goodness.
And I'm like venting to my husband, and he's like, okay, calm down. But like, the next day comes, and I'm like ready to go into work. I'm like, a new day, and you know. So I just want to know there's so many options that you can go into.
I feel like at the end of the day, after you end the day in crazy, in the morning you're like, okay, it's a new day. Thank God.
Yeah.
At least I have a job.
Yeah.
The people who don't have jobs, and with this whole pandemic thing, it's like, at least thank God I have a job. So that's the good thing.
Yeah, and I think a lot of people go into nursing because it's a very stable profession. Like, it's not going anywhere. There's always going to be demand for nurses, you know, so that's why people, and there are a lot of people that go into nursing as like a second career.
Even with nursing and my psychology, I've always said, like, eventually I want to be like a psych nurse. I don't know why. I know that's weird. People are like,
no, but you could actually, like, you know what? You see, that's another thing.
Yeah.
You could actually go into psych nursing.
And so many people are like, psych nurse? Like, really? Like, you don't want to deal with kids? And I'm just like, no.
Not everybody. You know
like,
what?
I'm like, kids are horrible. I'm sorry, but no. Like, no.
You know what's funny? A lot of people want to go into pediatric nursing. That has never crossed my mind. Never.
I cannot.
But like you said, you could definitely, with your background in psychology, you could definitely go into psych nursing. See, found your path.
What is your advice for people who are currently in nursing school? I know I made a video about things that helped me in nursing school, but then what is your advice
for people currently in nursing school?
Yeah.
Well, I would say that first off, you need like a very good support system. Because going through nursing school is going to drive you bonkers, and you definitely need a good support system. If that's your parents, your significant other, whoever it is, you just need that support system. And then you need to really establish how you study, like what helps you with studying and how successful that is.
Yeah.
You know, there are different videos that you could watch to see what kind of like how best you study. If you're a visual learner or whatever, that helps. And then I personally, what I tell everybody that I have come in contact with that is in nursing school, I tell them, I'm like, your first few tests in nursing school, like say this semester, most of the time in nursing school they give you like maybe 10 tests in a semester depending on the syllabus or something. Like the first 5, you want to like ace it.
That's true.
If you can get 100, and I'm not even exaggerating, if you can get 100, just get 100 on those tests, because the deeper you go, the harder it is. And the harder it is to pass.
Yeah.
And the thing with nursing classes, it builds up on what you've learned before.
It does.
So if you were able to ace the first few tests, you would definitely do well in the other tests, because you have that foundation. And plus, you're not like scrambling to get a 70 or a 77 just to pass the class. I hate it when I see classmates in the last test and they're like, oh my god, I need a 93 on this test or on this exam to be able to pass the class. We all know that it's most likely impossible if you've been bombing the other tests. Like, it's most likely impossible for you to get a 93 on the last test, and plus you don't want to put that pressure on yourself.
That's true.
So I would say like ace the first few tests the best that you can, and that way you can like kind of like study, but you know you don't have that much pressure to pass the class. Another thing I would say is don't skip classes. Don't skip classes.
Oh my
because
goodness.
at least that I have seen, the classes that I have been in, most of the time they tell you the things that are going to be on the exams or on the test. They tell you this is important, this is, this is going to be on the test, or you may see, but if you're not there, you're not going to know. So don't skip class, study, and I would say study to understand, and don't study to memorize. Because if you study to understand, if you see a question, you can kind of like filter out the ones that you know that, oh, this is definitely not the answer, this is definitely not the answer, and then you can make an educated guess on what the answer could be. But if you study to memorize, if you had it a certain way in your head and the professor like switch the answer, then you're messed up.
Did you teach us this?
Trust me, those has happened like several times and it didn't end well. So yeah, I would say study to understand the material.
I feel like another thing is like priority. Like if you don't set your priorities right, like you would mess yourself up. Like procrastinating pretty much. Because like when you start procrastinating and like, oh, I'll do this homework tomorrow and I'll do this. It piles up. Like I haven't seen any other program that the work piles up like nursing. Like they would say,
piles up.
I would do this clinical reflection tomorrow, and it's just like, okay, tomorrow I have to study for a test. Like
and for me, at least what I do that helps me, I try to get as much work I can get done in school, because I'm a kind of person that I am able to study and focus when I'm in a school environment. So I try to get like assignments and work, clinical paperwork, I try to get them done in school. That way when I'm home, even if I still have things to do, it's probably just like online modules to complete and stuff like that. Most of the time, some of my students or my classmates may think I'm trying to be an overachiever, and no, because I know I have so many responsibilities, and like you said, priority. I'm like, okay, if I can get this done in school, then I have a little bit more time at home to do something else. So just setting those priorities.
Okay, so my last question, and this is a question I'm asking because we're both Nigerian, obviously. Okay. So there's this thing when young people come from Nigeria and their parents are like, go do nursing, go do nursing, go do nursing. Okay. Would you advise somebody, maybe a friend of yours who's just moving from Nigeria, the person probably has no science background, nothing, the person never ever wanted to be a nurse, and they come here and you're like, my parents are forcing me to become a nurse, go to nursing school. What would you advise that person to do? First off, not everybody can be a nurse.
True. I feel like nurses are really special people because they have like a special kind of patience, and not all nurses have this patience that we're talking about, but I would say if you're thinking about nursing, or if you're being coerced to do nursing, at least before you maybe start a program, or before you get into the nursing school, whatever, you could either shadow a nurse, or like get a PCA job or CNA job, and just see what it is, to see if you would like it.
Yeah.
Regardless if your parents are telling you to do it. I think the reason most Nigerian parents are asking their kids to do it because of the stability we talked about in the first place, because the profession is so stable.
Yeah.
There's always going to be a job, and you'll be making a decent amount of money.
That's true.
So that's like their idea. But it's one thing to make money, it's another thing to feel fulfilled in your job. So you want to feel fulfilled in your job, and one way you can make sure that you're gonna like it is get a CNA job, or get something in the healthcare setting, right? That kind of like mimics, or is almost like being a nurse, or where you can actually see what they're doing as nurses, and that way you could like see if you like it. Some people don't like even being in the hospital. So
I don't like being in the hospital. I'm not gonna lie. I don't like it. So no.
I wasn't talking to you. You're it's different. But like, no, I think that's what they should do. And then, because you really don't want to like go through the stress of nursing school and then come out with maybe some financial debt, and then start working as a nurse and see that, ooh, I really don't like being a nurse. So, and you can always talk to your parents and tell them like, see, I really don't like this, and you know, this is what I want to do if you have something else to do. So yeah, that's my advice.
Okay. All right, guys. Thank you very much for sticking with us through this. I would call it a nursing school series, because we probably might film some more as we grow as nurses, as we learn new things. But thank you very much for watching. Don't forget to give this video a thumbs up, subscribe, and share this video. And I will see you guys in my next one. Bye.